Hello, I'm Troy Green,
And I'm Dr. Scott Knepper.
and we are Blue Agave Functional Medicine. Today we wanted to discuss what you might be ingesting and how that might be affecting your performance. You know, whether you're a young athlete or just looking to optimize your health, hopefully some of the stuff we go through today can definitely help you out and really hit on some of those topics. We're definitely looking back at our collegiate career. Dr. Knepper played collegiate lacrosse. I played collegiate baseball. And, at those times we were definitely gone through on, hey, you got to carb load before the game. You got to eat all the pasta you can. Well, I wanted to touch with you, Dr. Knepper, and just, fill me in, man. Did you have a different experience than I did at that time?
No, I think you said it exactly right. I think, one of the things we look back at is that the dogma of college athletics is always you've got a carb load. We're eating spaghetti, we're eating pasta, a lot of meals that, made sense at the time because we were thinking carbohydrates are fuel. We know we all need it in order to be at peak performance. But unfortunately, a lot of what we know now is that it's not just about carbs in general, it's about choosing the right fuel sources. And carbs, remember, is just one fuel source,
That's
right?
right. That's right. Now, on top of that, obviously, we have different proteins, but I wanted to hit on carbs a little bit more. We have simple carbs and we have complex carbs. Now, why are simple carbs not the route to go?
Right. So when you talk about carbohydrates as a fuel source, complex carbohydrates are, as the name implies, much more complex, larger molecules, and as a result, they're going to be digested, metabolized slower. So you're going to get more sustained, longer lasting fuel, whereas a simple carbohydrate you're going to burn through very quickly, and that's what leads us towards glycemic index.
Yeah, we've been hearing that get thrown around a lot lately. Really what it is that sugar crash. I'm sure we've all heard of, I ate a Snickers bar or I ate, a bunch of bread. I got energy initially, but then within 30 minutes to an hour, all of a sudden you're coming down and, it's almost like this peak and valley. You're hitting this peak of energy and then you come crashing down. And the issue is oftentimes we'll see that in the middle of work or, in the middle of your game, if you're an athlete, and obviously it's like you start the game off really well and then mid-game you're just crashing hard and it's all downhill from there. So what is it that we can eat that will help us basically promote longevity so that we can get through that work week or we can get through that game and continue to improve at our optimal level?
Yeah, exactly. And I think, the advice we have for diet and nutrition can be applied to someone who wants to be at their peak performance as an athlete or anyone that wants to optimize their health at any age, 80, 90 years old, just being more active. And the advice we give is, one, choose the right fuel source type of carbohydrate. They're not all the same, right? We know now that refined carbs, ultra processed foods, they're going to cause inflammation in the body that will actually hurt your recovery. And so it's going to hurt your ability to have good energy. It's going to hurt your ability in order to have sustained fuel that's going to last you through the day or at the same time last you through a game if you're an athlete.
Yeah, and, I can look back to my collegiate career. I played baseball in college, and there were games where I'd go out there and I had a great game. I was able to, I had energy throughout the entire game. I performed very, very well. And it was weird because, nothing would change, but the next week I'd go out there and I was crashing by the third or fourth inning, and I could never seem to figure out why. It's not like my exercise changed. It's not like my sleep patterns changed. It was just, and there was no injury involved. It was just I would go from here to here, and there was just this inconsistency. And now, looking back, it seems that the diet was playing a much larger role than we ever knew about.
That's exactly right. So think about this, Troy. So you're working hard. I'm sure you were a beast in the gym when you were in college. I'm sure you were, leading team in sprints, et cetera. But in all seriousness, you work so hard during the dedicated times that you have for training and of course, game time, that 60 minutes to put it all on the line. But the majority of your time is spent outside of that in recovery, right? And that's why it matters so much what you do outside of these hours. And so you talk about nutrition. Not all carbs are the same. I've said that before, right? If you have a refined carbohydrate, like white rice, for example, it's been stripped of its nutrients, including things like fiber as well, and other things that unfortunately you're selling yourself short. You're not getting the quality of the carbohydrate that you think you're getting.
Yeah, yeah. And we know now that it actually causes inflammation, which is making it even harder to perform. And I don't want to get, not just to touch all on athletes either. I mean, we're looking at this at the standard person going to work, and you're getting that midday crash. I hear it all day long at the clinic. I have to have a coffee around 2 o'clock because I'm just exhausted. Some people are like, I'm barely staying awake at my desk. Well, looking into why is this, because these same people are saying, I'm getting 8 hours of sleep. You're sleeping 8 hours, you shouldn't be falling asleep at your desk, right? Now, obviously, there are some medical conditions we need to rule out, but for the most part, it usually comes back to what you're putting into your body. I mean, we are what we eat, right?
Exactly. Exactly.
We definitely want to, look into this stuff. We want to be sure that we're ingesting the right type of carbohydrates. We want to make sure that we're ingesting high protein meals. And I definitely want to go into protein. There's so many different brands out here. There's so many different types of proteins. We've got animal-based. We've got plant-based. Fill me in. Where do we even begin with this stuff? Because there's just so much out there.
Yeah, exactly. So, obviously we know protein, those are the building blocks for muscle, right? Bone, lots of other health. Everything depends on proteins. Proteins are made up of amino acids. And so, one of the things that we always advise, again, whether you're an athlete or whether you're someone who, again, is just looking to optimize their health, be more active, and maybe add more muscle as well, we advise high protein diets. There's two major advantages to this. One, protein is what your body's going to need in order to build muscle. And then protein as a substitute is a high volume, low caloric food. What that means is that you can eat protein, feel full because it's a high volume meal, but it's not as many calories. And so when you get full off of something that is calorie non-dense, it's going to be a substitute for something else like a carbohydrate that is calorie dense. You'd almost have to eat twice as much volume of protein to get the same calories as in the same as a carbohydrate.
Definitely. And of course, it doesn't come with all that inflammation we're seeing. Once again, carbs, a lot of these simple carbs have been stripped of any of their nutrients. And so, yes, we're getting full, but once again, we're going to get that crash. So you want to focus in on the type of protein you're ingesting. I know for me, I really like to ingest, animal proteins. Now, of course, there's so many different options out there, once again, from animal-based to plant-based proteins. Talk to me a little bit more about this. Which route should we go? What do you think is the best option?
Yeah, so there's multiple ways to skin a cat. I've always said that one of my favorite supplements, whether you're an athlete or a non-athlete, is protein powder. One, because of ease of use. You can be active, you can be working, you can be away from home, and it's easy to bring protein with you. And at the same time, again, the ideal protein grams per pound for someone who's an athlete and wants to put on muscle mass is going to be a gram per pound. And that's a lot of protein. That's sometimes tough to eat per meal. If you talk about a 40-gram, protein chicken breast, you got to eat 5 to 6 chicken breasts a day. That's not always realistic for, an athlete or a busy mom, right? And so I advise, one of my favorite things is protein powder as a supplement. There's many different forms, right? There's plant-based, there's animal-based. What's the difference? It just depends on where they're sourcing the protein from. One of the most popular animal-based proteins that we've probably all heard of or had is whey protein. Whey is from, it's a dairy product. It comes from the cow's milk. Plant-based can come from peas, can come from other plant-based sources. There might be some differences as far as complete protein versus an incomplete protein. What that means is a complete protein contains all 20 amino acids. An incomplete protein means that it might be missing some amino acids, and so you'll have to supplement that. Out of the 20 amino acids, we know that 9 are essential. That means that the body cannot make it on its own. You're going to have to go get that from your diet. A complete protein, like whey protein, is going to contain all 20, so you don't necessarily have to worry about that. Now, when it comes to flavor, all of that, I'll defer that to the buyer's choice. But I think there are some important things you have to look at when you're talking about purchasing protein. And we're not going to endorse any brands here today, but that being said, make sure your protein is certified by a third-party lab. That's so important because they can advertise anything that's not, this is not an FDA regulated industry as far as protein powders are concerned, right? And so they may say 25 grams of protein, but some of that might be filler. And there's ways, these companies know how to add filler into their product where it may read higher protein content than it actually contains. And so these third-party labs will go and validate that to make sure that, again, you just want to make sure you're getting your money's worth. If you're paying for 28 grams of protein per serving, get 28 grams of protein per serving. Now, animal-based protein will have higher protein, it's going to be higher protein dense, And so as a result, you're going to get higher protein gram content per serving than you will from a plant-based serving, right? Which makes sense. And then the last thing that's important when we talk about protein shakes is, bioavailability and digestibility. And this is really at the discretion of the user, right? And so, the consumer has to determine. Some people digest plant-based proteins better. Some people may get some indigestion with animal-based protein, especially if you have any sort of dairy intolerance. You're not going to tolerate a whey protein. And so for this, you kind of just have to try different brands and find out, what works for you. In the world of protein, there are certain protein products like casein. You may have heard of casein. That has to do with, again, bioavailability. Whey protein is so popular because it's so bioavailable, it quickly is absorbed by the body and able to be utilized to grow muscle. So casein is only about 80% bioavailable, and it's going to be slowly absorbed and digested by the body, which means that casein is going to last longer. And so as a result, if you took casein at night, for instance, and you were going to eat for 8 to 10 hours because you're sleeping or maybe you're doing an intermittent fasting, casein is a great protein product to use because it's going to last longer. You're going to get consistent protein absorption throughout time or over time with a product like casein. Whereas whey, fast absorbed, fast utilized, that's going to be what you're going to choose post-workout, right? You just want something to get protein in your body, ideally within 30, 60 minutes after a workout, so you can start using that protein in order to, build up protein synthesis and muscle gain.
And while we're on the subject of supplements, I know that there's so many things out there. Obviously, you go to a GNC, for example, most things now, work their way into online stores, but I mean, you name it. I get overwhelmed sometimes. Patients come in, they've got bags and bags of supplements. They're asking me, do I need this? Do I need this? What would you say is your top 3 things that you would really, tell your patients, this is what you need? Obviously, that being said, if they've got electrolyte abnormalities via the labs, that's a whole different subject. But
right.
I'm the standard person coming in. I just need 3 things. What do you recommend?
Yeah, well, I think you hit the nail on the head. First, I think you do a great job of this with your patients. When we're talking about clinical conditions, obviously, supplements are tailored to the individual. That being said, if we're talking to the generic athlete, I love 3 things. Protein, where I touch based on that. 2 is creatine, and then 3rd would probably be something like branched chain amino acids.
Okay. And can you tell me more about these branched chain amino acids?
Yeah, so branched chain amino acids. So I talked about the 20 amino acids that we all utilize. Branched chain, as the name implies, just an amino acid that happens to have a branched chain on it, and there's 3 of them: isoleucine, leucine, valine. These are the amino acids that are so important in muscle recovery, workout recovery. And so these are going to be contained in the 20 amino acids that'll be a part of any complete protein, right? So animal source protein, your eggs, your chicken, that's going to contain all 20 amino acids. Your whey protein will contain all 20 amino acids. But some athletes in particular will benefit from taking additional BCAAs, which are typically sold in like a capsule form, and they'll take them before their workouts in order to aid in recovery. You'll have less soreness afterwards. In addition, you'll have better, faster muscle recovery. And so that's a fantastic supplement for any athlete to take advantage of.
I mean, and same thing goes, right? Let's say I'm a 50-year-old, for example, school teacher. Do I need creatine? Because what I've always been told, playing sports, that's where we utilized it. But there's this big push out there right now. I'm hearing a lot of these guys say everyone needs to be on creatine. You got to be on creatine. What's the validity to that? Do I need to take this once again if I'm not an athlete, or if I'm just looking to get back into shape? I'm looking to get back in the gym. Is creatine something I need to bring into my my regimen?
Right. So first, I'll address it in respect to athletes. So creatine. What is creatine? Well, creatine, again, molecule that combines with phosphate that is important in alactic energy. There's 3 ways that the body makes energy: alactic energy pathway, lactic energy pathway, and we use air, aerobic energy pathway, right? So what we're going to focus on when we talk about creatine is the alactic, meaning not building up lactic acid energy pathway. That's going to be high intensity exercise. Typically, these supply of creatine phosphate is going to be used up in 10 seconds of intense sprinting, high intensity interval training, or something like jumping, something quick, jump roping, for instance, something that's going to require, again, anaerobic, high intensity exercise, because the body's first going to reach for free phosphate molecules, right? Because What we're talking about is ATP, the body's main energy source. And so as ATP gets utilized, it loses a P, it becomes ADP, and then it needs to be turned back into ATP in order to be used as fuel again. Now, the fastest way the body can do that, especially in high intensity workouts, is to grab nearby creatine phosphate, right? And so that creatine holds onto a phosphate, it gets used up by ADP, and then boom, we recycle ATP, it can be used as energy again. Now that doesn't last forever. Those sources will get run out in high intensity workouts in about 10 seconds or so, right? Sprinter workouts, high intensity interval training. And so those are the athletes that are really gonna benefit from creatine. If you're doing high impact resistance training, if you're doing high weights, low rep, that's really where you're gonna see the maximum benefit. And so those athletes would certainly benefit from creatine, right? I think when we talk about non-athletes using creatine, there's potentially some benefit there in brain health. We know that, again, all of the body, especially muscle cells, are going to rely on ATP. That's primarily where we see this ADP to ATP and creatine phosphine being utilized is in skeletal muscle.
Yeah.
But there's some evidence now that it may be beneficial in cognitive health. And so that's why I think we're seeing creatine being recommended for non-athletes as well.
Gotcha. Okay. Yeah. I mean, that's all great things. I think that, especially what I'm seeing is majority of our patients, whether they were athletes, whether they're still athletes, they're just looking to, basically get back into the best shape possible. They're looking to optimize their health. Well, it's definitely good to know that there are some supplements out there that, people can take that aren't our Division I athletes, for example. And, getting into protein and being on the subject of protein, I really wanted to touch base on beef. And obviously there's this negative connotation with how it causes bad cholesterol, but we do know that beef is very high in protein. Can we talk a little bit about, does it cause high cholesterol? Is that bad?
Yeah, it's a great question. So animal protein, beef, high in protein, it's a fantastic source for building muscle, great for athletes and non-athletes alike. I think the question about cholesterol is really being kind of put to sleep, right? We know now that dietary cholesterol has very little to no effect on blood cholesterol levels. And so, unless you're at the extremes, you're really not going to significantly change your blood cholesterol with dietary cholesterol, right? And in patients that are interested in eggs, beef, red meat, etc., you don't have to worry about the cholesterol content. Again, we're talking about moderation to even high amounts. You're not going to significantly impact your blood cholesterol levels, and you're not going to lead to bad cholesterol or LDL.
Yeah, and that's one thing we do at our clinic. We run what's called an advanced lipid panel. I know that we're not seeing this that often. Everyone gets their standard cholesterol panel run. It usually puts the total cholesterol. You'll see triglycerides, LDL, and HDL. Well, now we know that there's different forms of LDL. It's not that simple. Hey, look, your LDL's high. We're going to put you on a cholesterol-lowering medication. I wanted to touch on that, right? We know that not all LDL is bad. LDL can be used for good too.
That's right. And I think a lot of the research and literature that's coming out now shows us that there's different sizes. There's large LDL particles, there's small LDL particles. And so when we talk about the bad ones, we're talking about small LDL dense particles, right? And so LDL is, again, a fatty protein that transports cholesterol. And I want to go back to what we talked about with beef, because one of the problems with some of the fattier beefs is that it contains a lot of these smaller, dense LDL particles, as well as triglycerides, and we know that those are harmful.
Yeah, I'm glad you're touching up on triglycerides. So triglycerides, we know, are definitely a problem child. And we know that they also, aside from just fats, they come from too much carbohydrates. Anything that's not burned by the body is going to be stored, basically, especially with carbs and fats, as triglycerides in the liver. And that's where we'll see that tick up in your liver proteins, your AST and ALT. Now, there's a lot of back and forth too about this omega-6 to omega-3 ratio. Now, I thought they were both good. Can we touch on that?
Yeah, so it's a complicated answer, right? So in isolation, omega-3 and omega-6 are actually both good. I think omega-6 gets a little bit of a bad rap, right? There's a lot of benefits to omega-6. We need it. It's important in cardiovascular health. I think where we go astray in the American diet is the ratio of these two, right? And so unfortunately, we've kind of moved to a 1 to 10, some studies even show 1 to 24 ratio of omega-6s to omega-3s. and that's very pro-inflammatory, right? And so that causes a lot of the health problems that we're seeing in metabolic syndrome in our patients, leading to long-term chronic inflammation that's really hurting their overall health. And especially for the athlete, it's going to hurt your recovery and really mitigate some of your gains that you could be getting. When we talk about omega-3, where does this stuff come from?
Yeah, omega-3, right? So we know obviously fish, hence why you'll see it in the capsule branded as fish oil or krill oil. But if you look at the back, they're both the same contents. It's EPA and DHA. Another thing a lot of people don't know is that the combination of magnesium, zinc, and B vitamins, which we can get through dark green vegetables, avocado, mixed nuts, these things are actually, they'll convert what's called our alpha lipoic acid into EPA, DHA, forms of omega-3 fatty acids. So we can actually get these through vegetables as well. It's not all from fish for you people out there who don't like fish.
And that's exactly why they're in our IV nutrition that we offer in the clinic.
Exactly. That's why we're now finding IV nutrition is so beneficial. It's not just for the hangover anymore. It's more so if consistently used, we'll see that ratio kind of come back to what's called homeostasis, meaning our bodies are very even keel. We'll see inflammatory markers come down. And that's definitely another thing we do well. And I wanted people to talk to their doctor about is checking some of those inflammatory markers, HSCRP, which is that high sensitivity C-reactive protein. These are cardiac markers. This is preventative medicine.
Exactly. I think, too, it comes back to our conversation earlier about bioavailability, right? And so antioxidants that reduce oxidative stress, a lot of the inflammation going on in the body, immediate bioavailability by giving something intravenously.
Yes.
So that's why we prefer that route.
Yes. I mean, the days of taking the anti-inflammatory and eating up your stomach, causing stomach ulcers, are kind of out the window. It's more so now changing our diet, and that's why they call these diets, they're an anti-inflammatory diet. It's pretty easy to hear that and understand what's going on, but most people don't understand why, and I think that's very important.
So I want to nerd out for a second here because Troy talked about anti-inflammatories, and what he was talking about was the class of drugs called non-steroidal anti-inflammatory drugs, NSAIDs. That's your Motrin, that's your ibuprofen, that's your Aleve, that's your aspirin, right? And so how do these drugs work? Is they work on enzymes called COX enzymes. And so going back to omega-3s and omega-6s, omega-6s have benefits. However, the most common form of omega-6 fatty acids that we get is from linoleic acid, right? That's the most abundant source in our diets. Linoleic acid can lead to arachidonic acid, which the arachidonic acid pathway goes through COX enzymes and then produces cell signaling that is pro-inflammatory. And so all of these medications that we talked about, that's how they work. They act on the COX enzyme. They're either non-selective, meaning they act on both COX-1 and 2, or some of them are selective. But the gist of it is they block the COX enzyme and they reduce the inflammatory signaling that is then produced, the prostaglandin synthesis, et cetera. And so it makes sense that, again, you would want to have the right ratio of omega-3s, omega-6s, so that you're not, again, creating this pro-inflammatory reaction that you then have to go take an ibuprofen afterwards.
Exactly. And that's what's so cool, and it's just not talked about enough, is that just by changing our diets alone, we can reduce inflammation. And that's why, years past, we didn't see such a reaction with autoimmune disorders. We didn't see Hashimoto's, with the thyroid getting out of whack. And it's because the diet was better. Looking back, the diet was always better. The issue now is it's just, we're all so busy, whether we're taking the kids to practice, whether or not we're working 12 hours a day to keep food on the table. We get home, we're exhausted. We just want something quick. And we think that a lot of these restaurants are okay to eat. But the problem is you're just eating them consistently, and we're getting this inflammatory response. And with time, we see chronic inflammation changing cells and leading to these problems, allowing autoimmune disorders, for example, to surge. And we see this on a daily basis at the clinic. So now we've talked about food. Tell me, what more in regards to recovery is quintessential, very, very important?
Yeah, I think the next item on my priority list is sleep, right? We know that during sleep, that's when proteins are synthesized, that's when the body recovers, that's when we replenish a lot of the fuels, a lot of the processes in the body that are being kind of used up throughout the day, that's when those are replenished. And it's so important. The body is beautiful and complex, and there's so many hormones at play. There's so many environmental factors that determine good sleep. We could probably spend another 60 minutes of talking purely about quality sleep. There's entire specialties devoted to sleep and sleep medicine. But I think when we're specifically talking about, again, patients who want low-hanging fruit on how to optimize their health, and specifically regarding our backgrounds, right? What's something that we wish we had known when we were athletes? Well, I wish I had known how to manage my sleep better.
Sure, sure. Listening to your body. I know, in college in particular, it was always rushing to the next thing. It was grabbing a quick meal. I'm exhausted from practice, but my buddies want to go hang out. I'm going to force through this thing. I'm not going to sleep. I'm going to have an extra cup of coffee and push through. I think that's one of the things I would have changed is just, hey, listen, your body's worn out. Give it the rest that it needs, especially like you're talking about recovery, right? You're working out all the time or you're tired from work, your brain's shutting down. Listen to it. Get that extra couple hours of sleep, and I think that it'll carry you through the rest of the work week.
Yeah, and the bodybuilders know this, right? So, bodybuilders will always talking about quality of sleep with the workout. Because essentially, if you don't recover, and this is why we preach this so much, you spend most of your time recovering. You've heard me say that before. Because if you don't spend time recovering, you're not maximizing the work that you've already done. The workouts are hard enough, right? I mean, we probably both have puked on, an intense workout in college. You've had your coach screaming at you. You've already survived all of that. Why would you waste it? You don't want to do it over. You want to maximize every ounce of benefit you can get from the work that you already did. Get credit for what you've done. And this is how you do that. It's in recovery and it's in sleep. So I think my number one piece of advice for anyone who wants to maximize their potential for recovery, as well as take advantage of, again, their best health and the work they've already put in, is to wake up at the same time every day.
Yeah.
And I know that's hard to do when you are a college athlete. There's a lot of demands on your time. These college kids are staying up late partying. I'm sure you never did any of that. But at the same time, waking up at the same time every day has huge and profound effects on the body. It's important for hormone regulation, for the pituitary to recognize external factors like light to the eyes. All of these things play a role in regulating the body's mechanics and biomechanics as far as these processes that we're talking about that are so important in not only muscle generation and synthesis, but also in just recovery and energy. And sleep medicine doctors will tell you, regardless if you go to bed late one night, early one night, waking up at the same time every morning is quintessential to maintaining good sleep habits.
Mm-hmm. Yeah, I think building that routine, not only as an athlete, but even into your working days, even through the weekends. That's one thing I see that's a big mistake with a lot of our patients is they'll get with this great routine during the week where they're waking up at, for example, 6:30 every morning. They're getting their cup of coffee. They're going through their routine. They're eating healthy. But then Saturday comes around, and they stay up late Friday night, they sleep till 10 o'clock, and then it throws their whole schedule off. And then so come Monday, they're playing catch up. They're starting the week off exhausted.
Yeah, exactly. And I think, again, they're selling themselves short, right? They've already put in all hard work. And same thing for a non-athlete, right? I mean, you're busy, you're trying to get the workouts in while you have time to do it. Unfortunately, then you stay up too late, you wake up too early, you get the screen with all the world's knowledge 6 inches from your face with blue light. All these are external factors that throw off your body's natural processes that would otherwise have contributed to quality recovery and sleep.
Definitely. And yeah, we see that in the clinic too. I'm seeing it with the younger and younger generation. They're coming in, they're telling me I'm not sleeping, I'm having problems. This has been something I've been dealing with since I was younger. And I just think that, this needs to be a subject that's addressed more and more. Well, it was great getting to talk to you today. I know that for the people listening out there, this is something we're really passionate about. We love talking about subjects like this.
Yeah, if there's anything else you guys would like us to talk about, just leave a comment.
Please note, the information discussed in this podcast is intended for educational and informational purposes only. It is not medical advice, nor should it be considered a substitute for professional medical guidance. Always consult your physician or qualified healthcare provider before making any decisions regarding your health or treatment plan. We appreciate you joining us today. Until next time, take care and be well.